Hello fellow anesthesiologists and HCA medical directors. I'd like to show you a quick glimpse into a anesthesia information management system that we've been using for about 6 years now in the Sugar Land, Houston area called Shareable Mobile Clinical Documentation, all for the busy anesthesiologist on the go, and then it's best used on an iPad here. And they also handle larger clients like Envision and some Harvard-based facilities, so they're good for all forms of cases as well as anesthesia group sizes. We do use them as inpatient facilities with hearts, cath lab cases, labor epidurals, as well as our surgical day surgery patients. So it's all encompassing, and it does do quality measures. As you can see, another tab opens up for your e-pre-op, so you can turn in those all-important quality measures that we love to do. Let me show you just how incredibly easy this thing is to use. So intuitive, takes only about a minute or so to really train a locums on it, all via touchscreen, of course. This is where you'd encounter your patient, and let's start a pretty quick case. Let's say an EGD, for example, page 1, where all the pertinent information has to be done, signatures and everything. The best thing to do is jump right into a template, which you can make as many as you want, customize in any way, shape, or form. And it just automatically pre-populates most basic things here. This is a test patient, of course. Bottom here, you'd sign your attestations and all your signatures. I'm just going to do one of them here. Remark section, super easy. Type it in yourself, voice text, or even better when you're on the run, use a pop-up box there to pre-populate it. Up here in the diagnosis section and procedure, it has predictive and sort of semi-auto text, so it remembers what you've done before, and you can choose those choices, because a lot of times the procedure and diagnosis are pretty repetitive if you've done EGDs, which we've probably done thousands in our lives, our careers rather. And you fill in a few other things, simple touch of the screen. Then it's time to go to your vital signs. So down at the bottom here, you just click your vitals. And if you want to set it up yourself, as I have, you'd go directly to a template and it would be ready to go. For example, TIVA, jump right into your case. You can do it manually, but why bother? And you'd obviously start the time here. Really easy functionality, as you can see. And one of the things to note is the color schemes do try to represent what you encounter in real life. Yellow for propofol, blue for most narcotics, things of that nature. And this is of course, fictitious patient. And what about all this redundancy here? As your case moves along, you can double tap, as you can see here. A quick double tap repeats that finding. That is very, very helpful. Some of these you don't even need for an EGD, but I just did it anyway. Here's your fluids. You can even put continuous, and it'll have a line there. What about the vitals? As you put these vitals in, you can be super accurate in this circle here and literally type it in a matter of moments. And if you want to touch the screen, you can do an approximation like that, close it down, or if you think they're pretty similar, double tap and it carries over, okay? Easy breezy. You can air print it to PACU, day surgery, ICU, air print it to labor and delivery, anywhere you want it. It also totals the medications, as you can see here, all the things that you've used, so your pharmacy reconciliation is on point. So definitely don't hesitate to call me if you have further questions or want a in-depth, detailed information or demo, live demo of this anesthesia information system. And if you are definitely interested in providing this wonderful service at your center, I'll be happy to help join in the opening process and even do cases there side by side to show you just how easy it is. Total service line here. Please contact me at shareableehr@gmail.com in the description below. All right, take care. See you next time.